talking about bladder cancer today, since June is Men's Health Month.
Yeah, a month for men to be aware of bladder cancer. Joining us live this afternoon is Dr. Matt Johnson, a urologist with Aurora Healthcare. So how common is this type of cancer?
It's pretty common. It's a lot more common than you think because we don't often hear people talking about bladder cancer. It's pretty personal. It's the fourth leading cause of cancer death in men. And it costs about between 70 and 80,000 diagnoses per year in this country. So pretty common.
Does it affect a certain group of men, say, are at risk than others?
Generally, it's an elderly person's disease. It's 3 to 1 men versus females, so men are affected more frequently than women. And there are risk factors. Smokers, for example, are at much higher risk for developing bladder cancer, but other people who are exposed in the workplace to certain occupational hazards can develop bladder cancer too, but that doesn't account for all bladder cancer, unfortunately.
So we see a lot of people that are required men, do the PSA tests and perhaps the colon tests. Is there something we should be doing to stay on top of this? And what are the symptoms and signs of bladder cancer?
Yeah, definitely. Unfortunately, a lot of bladder cancer occurs completely silently, and the first time we'd ever even think to look for it is microscopic blood in the urine or change in urinary symptoms, something fairly, difficult to sort out, particularly if somebody doesn't go to the physician. And that's one of the things with Men's Health Month, is encouraging men to make sure that they have an established relationship with their physician. And these things can then be screened, during that appointment or labs or something like that. So.
Other than having a nagging partner telling you to go get checked.
That's it. That's usually what happens.
What else is Aurora doing to try to help the need and get this word out?
Well, when somebody is when there is something that indicates a possible need to look into whether somebody has bladder cancer or prostate problems, you mentioned PSA, etc., then there's a referral to a specialist, to a urologist. And if there is some concern, then imaging would be ordered, cystoscopy, or looking into the bladder to identify whether somebody has a bladder cancer at that time.
Now, you're doing a lot of robotic surgery. How is that happening, and what's going on with that?
So we're really in a great spot with working here in Milwaukee and Aurora St. Luke's. They've invested a lot of resources and time and effort to develop a multidisciplinary program. We use advanced imaging, advanced laparoscopic techniques. You've heard about the robot, Da Vinci robot, to do robotic surgery. We do that for prostate removal, kidney removal, bladder removal, and now we've been doing that for years. So we have a lot of advanced surgical techniques to help people who have been diagnosed with bladder cancer.
Well, you heard it. We've got great experts right here in Wisconsin.
Thank you, Dr. Johnson. Got a question for our experts? Email them at asktheexpert@todaystmj4.com. You can also leave a voicemail right there on that number.